Afternoon. Welcome to the next session of as a part for this online course. I'm Kapil Oberai. I'm faculty in the informatics department at IERS. Today's topic is role of internet GIS and mobile GIS in COVID-19 pandemic. This is a lecture outline that we have got. So we'll briefly review a little bit of GIS and how does GIS plays a very important role in health crisis. Then we'll also a little bit look at the COVID-19 pandemic, how it has evolved. Next, we'll also discuss various common GIS use cases that are being employed for combating the COVID-19. Then we'll delve into the intricacies of how Internet GIS and what are its various characteristics, followed by this component in architecture. Next, we'll see what are the various Internet GIS related applications targeting this COVID-19 pandemic for combating and tracking related activities. We'll also see what are the various softwares that will enable us to develop these internet-enabled application towards COVID-19, either in proprietary or in open source. Next, we'll delve into the other second part of this session, which is on how does GIS-based mobile apps are useful in COVID-19 related pandemic. We'll also see its characteristics, the architecture, and also we'll see in order to develop some of these mobile-based solutions, what are the various open source and proprietary softwares that are available, and then finally we make conclusions on based of this lecture topic. Now we know that Geographic Information System, or GIS as it's called in short, is a computer-based system that provides following four sets of capabilities and primarily deals with the georeference data. Now these four sets of capabilities are: it allows capturing or input of data, and further it also allows us to store and retrieve those georeference data. That is how, and further it also allows us to manipulate and analyze and finally visualize the georeference data. So basically GIS differ from other information system, let's say from a management information system perspective, from its capability for handling the georeference data, not only storing and inputting, but also manipulation, analysis and visualization based on the georeference data. Now, the location is very important in every decision making, right from our day-to-day decisions that we make on where we should go for eating tonight, or where should we go for buying our grocery and so on. All depends on the location. So where is very important, apart from when and who. So GIS basically provide tools which epidemiologists use in identifying and evaluating the where to understand how the disease is spreading, to identify the hotspot areas and so on. The widely used capability of GIS, which is mapping, which is digital based mapping, is very important tool in because in this case of a COVID or health emergency, we should identify where the people who are affected by this disease are residing, so that we can track them and combat and prevent the spread of those disease. Now, from this topic perspective, Internet GIS and mobile GIS based solutions like real-time maps, dashboard, mobile apps are being used widely for combating the COVID-19 related pandemic, in order to have a real-time assessment of what is the situation on the ground and make informed decisions by the decision makers. So what makes GIS so important in addressing this health crisis is that it enable us to understand how does the disease is spreading, and where those patients, or where are the crisis occurring in which location, so that the necessary intervention by government and health officials should be taken in correct time to address that things going out of control. Now we go a little back in history. So the spatial analysis is not new. If you go back in literature, and there was a epidemic outbreak of cholera in London Soho district somewhere in 1854, and then we have Dr. John Snow, who basically used a manual mapping method for identifying the death related to the cholera, and also he mapped the location of the water pump. At that time, it was not proven that the cholera was a waterborne disease. So what he did was he mapped the locations of the water pump along with the deaths in the Sohor district, and by creating a map, it becomes very evident that most of the deaths, which is depicted with a red dot, red plus symbol, is confined within this central water pump. So he was able to prove his hypothesis, saying that because people are drawing water from this water pump, so that's why these kind of deaths are happening. So he informed the authorities, and the first step that was taken was to remove the handle of the water pump, and the death rates come drastically down. So the thing is, this mapping is very, very useful for identifying, tracking, and then taking informed decisions. So this was way back before the digital age, where the maps were drawn in hand. But now with the digital mapping being automatic done in GIS, it really helps the decision makers in getting the bigger picture, holistic overview of the situation, and make informed decisions in almost near real time. Now, COVID-19, we know that it is a form of an infectious disease, but it spreads very fast compared to other coronavirus we have seen either in the terms of MERS or SARS that we have seen in 2002 and then 12 to 14. So it was identified in Wuhan in China in December 2019, and now we are in June 2020. So in roughly 6 months, if you see, it has engulfed the whole world, and more than 180 plus countries are affected. The first case was tracked in Wuhan in 17 November 2019. Subsequently, World Health Organization WHO first put this outbreak as a public health emergency of international concern on 30th January 2020, and then finally it was declared pandemic on 11th March 2020. So as of dates 15, this is as yesterday, 15 June, so there are more than 7.9 million cases spread more than 180 countries and then under territories, and there are too many deaths that have happened because of this coronavirus. But good thing is there are also people who have recovered. More than 3.76 million people have recovered. Now the other things which put this topic in perspective is, now since we don't have a vaccine or drug, so only thing is of prevention, so that we reduce the chance of infection. And also, how can the technology be employed for identifying the risk prone areas, take necessary decisions, make the information available to the decision makers, because ultimately it is a to win this from this coronavirus, the public participation and also the public has also been taken into the confidence. The role of public is very important, so we need to use internet based methods or web mobile based solutions to aware them. And we know that there are three important things to be understand for preventing this disease, which is maintaining a social distancing, covering with the face cover of a mask, and then washing hands with the soap and water with more than 20 seconds. So with this, because of this vast spread and infectious nature of this disease, it has caused an havoc to the whole world, and started from Wuhan and maybe reached now the various countries, and various countries are still struggling, and a lot of deaths have happened. Now, if we talk from the COVID perspective, the various GIS use cases, as we say, GIS helps us in provide a series of tools, whether doing mapping, querying both spatial and base attribute querying, also do a modeling. So maybe it could be a epidemiology model linked with a GIS, where GIS can help in, let's say, preparing the data set, and finally the result could still be visualized in GIS. So it could be loosely coupled, tightly coupled kind of solutions also. But the GIS is very good in understanding and identifying the phenomena over space and time, so we can understand and get insight into the data, so we can identify the various patterns, the relationship, as we discussed in the Jon Snow example previously, where the relationship between the depths and the water being drawn from the pump was really evident. And so these kinds of relationships will help the health professionals and also the government to make smarter and also make effective decisions with less amount of time. Now, since this disease is spreading fast, obviously we have to take the timely decisions. Therein, this GIS information-based system approach is quite useful. And further, we have to disseminate this information faster than the disease spread, so that the necessary actions could be taken. The other good thing about GIS is it integrates other data sets, so we can link with demographic, imagery, social media feeds, what people are saying, where the people in distress, and then combine them into a digital uh, geographic database where we could have identify those layers as series of layer stack and make various kinds of decisions by combining various layers. The GIS use cases or tools like mapping, which is digitizing or tracking the where the health facilities are, or where are the people who are affected by disease, where are the quarantine centers. So mapping and then data collection apps to track the cases, identify the spread, to see how much time the disease are spreading, and also to identify the vulnerable population in places, because we know that this COVID-19 is very serious on the people with comorbid uh, diseases who are elderly. So we can, using these GIS based softwares, we can link various data sets and identify people in distress. And also some places the social distances may be difficult, so we can identify those high population density areas and then maybe do target surveillance and awareness in those areas. Further, from the perspective of role of internet-based GIS and mobile-based GIS, dashboard has become a very good tool wherein real-time situation awareness is made available to the general public along with the health officials and government. Further, mobile and web-based applications are also being developed, which also keep the public informed. Common use is Arogya Setu, and then also the dashboard applications being developed at the both at the global level, at the national level, at the regional level, and also at the municipality or the corporation levels also. The GIS also is helpful in identifying the resource locators. So we can identify the people can help to identify where are the crucial aids and resources, COVID care centers, quarantine centers, test centers. Further contact tracing and mapping could be done for, because we know that it spreads from a human being to a human being, and we can identify in case a person is affected, then what are the contacts, and we can trace it over space and time. The typical GIS use case of network analysis or optimal route determination would be very useful in identifying where are the containment zones, so that we can avoid those containment zones. The concept of geofencing, alerting people if they are entering to the red zone or restricted zone. Further, the apps and the maps are also used for identifying the COVID related hospitals, healthcare facilities, and maybe navigating the patients to those facilities where the beds are available. The GIS can also support in various health interventions, for example, the real-time situation awareness to monitor the phenomena. Further mapping the hospital, as I said, healthcare facility, the testing centers, and also for the quarantine facilities, identifying people who are in isolation. And then further it is, we can also use this mobile-based solution for enforcing the strict quarantines, because as I said, it spreads from human to human. So if we somehow break the chain, then we could reduce drastically the number of cases. The GIS, after, as I said, allows data to be captured from various sources, link them, organize into geographic database. So once we have a database, then GIS can help and answer those location related queries that we mentioned previously, which we can easily identify where are the maximum reported cases, so that we can enforce good prevention and healthcare infrastructure facilities in those locations, testing and so on. We can also find out, as I said, the most vulnerable population by linking the demographic data, the census data, and so on. We can identify the people who are in, as we say, the first people above 60, and those are vulnerable, and also people who already have a immune compromise are further affected. Can be once affected, the disease could be really fatal. Further, we can also identify by looking at the population data, the densely populated areas, and then take in preventive actions so that the spread and all those and awareness program could be done. And further, we can also identify where are the COVID dedicated healthcare facilities, how to reach them, what are the helpline numbers. So all these things could be really combined into mobile or web-based solutions, and then all those decisions could be made and given to the end users. Now, after seeing the various use cases ranging from mapping to tracking, tracing, identifying, locating, and so on. Well, now let's see what specifically what is Internet GIS initially, and then we'll get into what are the various applications that this it serves in combating the COVID-19. So Internet GIS, there are two words. One is Internet, second is a GIS. So what we are doing is we are combining the power of Internet, which is a worldwide dissemination medium, and with the power of decision or the tools that GIS allows that we have discussed previously. So we are combining the dissemination platform, so which means Internet is a widely used medium for disseminating information. So can we combine the power of Internet uh, utilizing along with the capability of GIS, so that not only the data could be analyzed faster, but all the information could be readily available in near real time to the decision makers, and also communicating it way down to the grassroots level to the public in general also. Now, the Internet GIS is generally defined as a GIS tool, spatial GIS tool that use Internet as a means for accessing and transmitting the remote data. Now, in a traditional desktop-based GIS, most of the things resides on a single standalone PC or a system, which means the data, the processing, the visualization all happens at the one node, and it's difficult to share data, share results in a quick possible time. But if we use the Internet as a platform combined with GIS, then we can access and transmit the remote data, because people can now access these applications through simply their web browsers. Web browsers could be available either in a desktop, a laptop, or let's say handheld small devices, and so on. We can also conduct the analysis, and then finally the result could also be finally displayed. Uh, Internet GIS can also be said as a framework of network GIS that utilizes the Internet to access the remote geographic information along with the various geoprocessing tools that we have got. So basically, Internet GIS is a spatial GIS tool that uses Internet for not only accessing and presenting data, but also conducting analysis. But the restriction that here now the n number of people can use those kinds of applications, not only the restricted to one users. Now coming to Internet GIS, now this is not a new thing for common man. We use Internet GIS applications in our day-to-day life also. The classic example is a Google map, and the example being if you want to go from place A to place B. In this, it is from our Dehradun airport to, let's say, people coming to IERS. We can find out how far it is, how much time it will take. Similarly, there are other use cases. Every time we use a train tracker to identify where the train is, how much time it will take, we are using an Internet GIS-based application. If you're using any tourist-based tourist application, identifying the tourist places, how to reach them, again we are using these applications. If you're looking for a new property, identifying where those properties are, what are the prices, what are the amenities around us, all those things again come under the gamut of those Internet GIS-based solutions. Now, what makes Internet GIS different from the standalone is that it basically works on the principle of a client-server model. As I said, standalone GIS, all things happen in one place. However, in Internet GIS, there is a bifurcation of tasks. So client is a user who is requesting the request, who is asking for the response, and then server is a remote application that is hosted at somewhere at the remote location. So there is a bifurcation of job. Client role is to send the server for request, and the role of the server is to address to the client request. This request and response mechanism happens over an HTTP using a request and a response model. Again, so this Internet GIS application could be further classified based on a thick client or a thin client, depending on where the processing is happening. Further, Internet GIS is an interactive system. If we compare it with a Bhuvan or a Google-based map, so people can interact with the maps. You can zoom in, zoom out, pan. You can query, you can identify. I can file various kinds of queries and then come up with the desired result that we are looking for. Further, Internet GIS is a distributed system, which is unlike a desktop where all things happen at one place. We can access the remote data. We can combine data with other sources. So this is where the OGC Geo Web Services concept comes into the picture, which enables interoperability and concept standardization. So the data from one system could be accessed, could be enabled in a standard interoperable way to be accessed by other applications. The good thing about Internet GIS, it is a dynamic system. Where, now consider in the case of COVID, so every time, let's say a new red zone or a containment zone has come, immediately if we update the map on our remote server application, the moment any user sees that request or serve a new request, he will be able to see that containment zone. This is unlike a standalone system where the data has to be physically moved from one machine to the another in order to get the real data. Another example of a dynamic Internet GIS, a dynamic system which we also use in our day-to-day life, is the example of a traffic maps that we use. So based on the current traffic situations, we can see the different routes. So basically GIS is able to incorporate the data, update the data, and then user will be able to see the data in a real time. The other thing about Internet GIS is here we use web browser as a client, so user don't need to learn any GIS software. Further, don't need to install any GIS software. He just needs an access to the internet along with the web browser installed on his client. That client could be mobile, could be desktop, could be other handheld devices. Now this is what makes GIS as a cross-platform, which means since the client is a browser, so browser can run on a Mac or a Linux on a Windows, so it does not matter on which platform you are accessing. So using this concept, the range of the users has been increased, and then we are not bothered about installing any software for running per se. This is different from the, let's say, standalone desktop GIS solutions, wherein there is a different software for Windows, for Linux, and Mac. So based on the platform, the solution has to be deployed. Further, once the application like Internet GIS is deployed a remote location, n number of users will be able to access that applications. Whereas in the case of a standalone, it is one machine, maybe one user could access those resources. So the advantage of Internet GIS is by combining the power of internet, we have wide accessibility. So users can access this data, especially let's say in the case of a COVID, where are the patients, where are the the hotspots areas, where are the quarantine centers, and can perform analysis using any device which have access to the web browser and the internet, and they don't need to install any GIS softwares, and also the acceptability and accessibility is also increased. Now also GIS users can directly manipulate the maps over the web. Again, they don't need to learn any GIS softwares. And further, as we said, since it is a dynamic system, the GIS can also incorporate up-to-date and real-time information. So the moment the data is updated, which is being done in, let's say in the case of COVID, 2 times a day, I guess, somewhere in the morning and also after the briefing, in the Indian context I'm saying. So the moment the information is updated, any people will be able to see that information in almost near real time as soon as the data is updated. No need to move the data physically from one machine to another. Now talking about the components, so as we said, this works on a client server model. So we have a client, in this case it is a web browser, and then there's a internet server, or we say as a web server. Now in the case of an Internet GIS application, we also require a map server which can process the GIS related data, with the data residing in the data servers, either in the form of a raster or a vector, and then we can also publish our data in the form of OGC standardized services. So in our case, the client is a web browser, makes a query over the internet to the web server, using the URL of those servers. The Internet GIS server further passes the request to the map server, which takes the data, does the processing, return the result to the web server, which is used for serving the static and dynamic web pages, put the map along with the other content and relay it back to the web browser. So every time you access a Google or a Bhuvan map, so every time you do a query, a new request goes and a new response comes from the server. Now talking about, so having seen this uh, importance of GIS with the location perspective, understanding that GIS can handle or understand a phenomena both in space and time. That the tradition, the historical use of GIS, which was John Snow, his cholera map, going way back into the typical uses of GIS or mapping, tracking, allocation, related navigation facility, identifying the where questions, interlinking various data into the geo databases for answering those questions, and understanding what is Internet GIS, the components. Now let's see what are the various applications of this being used in COVID-19. So one of the application that is widely used is called as the dashboard, which provides very key insight to the decision maker at a glance. The meaning of dashboard is to have a geographic related view of the various key performance indicators, so that in a single window you will be able to see the various components. For example, in this case, John Hopkins University has come up with the first dashboard related to COVID-19. So using at this single dashboard, looking at a glance, the decision maker can see what are the various total cases, what are the various cases that are being reported at various countries, which is a country which is having the most number of cases, and then we can also see in the single window through a graphical representation what is how does the cases are being increased, what is the total number of deaths, and so on. So based on, if we zoom in and zoom out, the number we can narrow down to the region specific and then get those numbers. So looking at this dashboard in a single snapshot, the person can see how does what is the total number of people who are affected, how does the spread is happening over a period of time, can we drill down and see those operations. Now, this John Hopkins map was first shared in January 22. This is before the WHO comes up with its own dashboard. Now, this was primarily developed by Professor Lauren Gardner along her team at John Hopkins University in the Center for System Science and Engineering. The purpose was to provide researchers as well as the health of authorities and also the public in general with a kind of a very intuitive user-friendly interface to track the outbreak. So looking at this, we can see which are the places where the number of cases are reported, where the number of cases are more, and see it over a period of time. Further, as I said, it also showcase what are the confirmed cases, confirmed infections, how many have recovered, how many fatalities has happened, and also using the graphical means one can see the progress over a period of time. A good thing about this is all the data sets that they have collected and mapped can be accessed through this GitHub link that I have given on the bottom. So in case you want to access to this data set, it is available through this link. Further, they have used various data sources ranging from WHO to the US CDC, the European Center for Disease Prevention and Control, along with the data coming from the Republic of China, also local media reports, local health department, and the DXY, which is the Chinese online medical resources. So they were able to collect information from various sources and then come up with those numbers on the fatalities, the people who have recovered, and so on. Similarly, on the same guideline, this dashboard provide a good insight at a single snapshot of what is the current situation related to this COVID at a globally. It can also be the locally. We'll see in the subsequent slide. So the WHO dashboard provides information on the COVID-19 cases along with the death reported by various countries, which are reported to the WHO. Now this dashboard could be accessed to this COVID-19 who.int. Now, looking at this dashboard, they are using a choropleth map option or a bubble map option, which using a symbol to denote the number of affected people. So I've clicked on the choropleth map. So looking at those choropleth map, we can see that which are the regions wherein there are more number of cases reported, and then on the left hand side we can also see the cases, the what is the new cases as on this is yesterday, and then what are the total number of confirmed cases and how many deaths have happened so far. Another again on the bottom right in this dashboard there is an option of downloading the map data. So if you click on this, you can download the data and then utilize this data in your own analysis related tasks. Further, if you drill down below this dashboard, so you can see also how does the cases, confirmed cases, have increased over a period of time from the January till May 31st. You can see the daily, you can also see the hourly. Similarly, the death over a period of time, you can also track it over you can see how the death have also increased, and now suddenly it is coming down, but the number of confirmed cases is still rising. So further, if you drill down on those dashboard, you can also analyze the situation by country, territory, or area. So you can see the Brazil, the India, the number of cases in the last 7 days. On the right hand side, you can filter whether you want to see the 24 hours, the last 7 days, and you can also see the cases along with the deaths reported. So you can see that for the United States, it has peaked and now it is closely stabilizing. The curve is looking like stabilizing. Similarly for Russian Federation, and then for the also the cases in our India and Brazil is also increasing. Now the other thing about WHO is they have utilized this dashboard also to provide awareness for the specific regions. For example, this is a they have again created a different dashboards for understanding the spread of COVID-19. In this case, it is related to Southeast Asian region. So we did the previously what we have seen at the whole global scale, but we can narrow down further, see how it is the situation over the Southeast Asian regions. Again, in the South Asian region, India again is having the most number of cases, followed by Bangladesh and Indonesia and Nepal. And again, we can see the progress of those cases and how many cases are being reported in the various countries in the South Asian region, along with the global trend is also available here. So one can compare what is the situation of globally related to the Southeast Asian regions. Now, another thing that Internet GIS based application apart from dashboard is a concept of a story map, wherein we can this is a good example wherein you can trace the origins of COVID-19. We know that it started in from Wuhan district, and using this simple time slider, a story can be built to showcase how this slowly the virus has spread from Wuhan to the various countries based on the people traveling, and then some kind of restriction on the air travel was also imposed. And you can see that in February 4th, most of the regions, Australia, America, and all those places were affected. Then again in coming into the March and other places, the people in the what's called Iraq, Iran, and all those places are also affected. Then Brazil, somewhere in February 26, it got the first case, and subsequently it spread to the other what you call African countries. So this is a good way of again depicting the origin and how it has spread using the concept of a story map, apart from the dashboard that we have seen in the previous cases. Now this dashboard utility is being utilized by various countries. For example, India also have come up with a dashboard by Ministry of Health and Family Welfare, wherein they are updating the data sets related to the active cases, the people who are cured or discharged, the number of fatalities, and also people who have migrated to other places. So using this dashboard, the real-time information on the COVID situation can be done, along with the status of those cases with respect to the various states and also the districts. And the good thing is it also provides access to the resources like various guidelines, the standard operating procedures, which is quite useful, and travel advisories, all confined into a single application. So it becomes a one-stop window for people who want to know more information on the what you call guidelines coming up from the government of India, and also the training material, what are the various precautions to take, and all those things can be readily accessible through this website, and it really help in controlling and managing the spreads. Now, from the ISRO perspective, Bhuvan has also come up with application related to COVID-19. So there is a COVID-19 dashboard which provides country and state level scenario of the spread of COVID-19, along with the time series visualization. We can see how the spread has happened in the country, along with the reporting what you call dashboard, wherein we can drill down and see the various information with reference to various states, how does the spread is happening. So as I said, first is this COVID-19 dashboard, which provides state-wise growth, which is pan-India, and then the numbers are in sync with the Ministry of Health and Family Welfare. So looking at this dashboard, people, one can see, again, this is of yesterday, so the total number of cases, total number of active cases, per people recovered, people who have succumbed to this disease, and also you can see the present growth status over a period of time. These are all the union territories and the states, and you can see here that Maharashtra, Delhi, and Tamil Nadu are the places where the most number of this confirmed cases has been there. And then we can also see the day-wise spread of those cases, and also see the pan India and the number of people who are affected. The other application this Bhuvan is given is this available on this URL, bhuvan-app3.nrsc.gov.in/corona, wherein all the information related to Corona 2020 in India has been given. So the information related to the test centers, so all those pink denote the test centers. So if you click on this test center, you can see the state. You can also see the place, test center, where it is, also the helpline numbers, and also we can get the direction. So how, based on how should I reach to that test center, is also available. So utilizing these kinds of dashboard, the readily information is available to the general public, so they can also use this information in case of any distress. Further, we can also see the status of the cases with reference to each particular state, active, recovered, and disease. Or we can also see the whole India perspective by clicking on the all state. Then we can also see the summary, which basically show the bar chart of how does the cases have the status of cases at different states or the country level. And then we also have a time series view here, where we can see how does the number of cases have spread based on those timing window time slider. So as I said, so this was a test center, can be easily accessible. So clicking on the get direction, you can enter your location and where you want to go. So it will show you a turn by turn direction to reach to that test center facility. Similarly, if I click on the state, and here I've chosen the state as Uttarakhand, and then if I click on that view button, I can see the number of cases that are there in this Uttarakhand state. So we can see that there are this many number of confirmed cases, active cases, recovered, and fatalities, and we can zoom in to further view it. There's the legend and other things are also available here. But if I click on a summary, as I said, we can see a bar chart again depicting the cases, active cases, death, and the people who are cured. So using this kind of dashboard based applications are really helpful in both at the decision maker health official level to decide where the interventions has to be required, and also from the public perspective where all the information that required in case they have some distress can be readily available. So from the global, wherein the John Hopkins dashboard along with the WHO to the ISRO Bhuvan initiative of the global Indian perspective, along with now we are going from global to the local So even the states department along with the various city level dashboards are being utilized, seeing the importance of this web-based dashboards application for real-time monitoring and control. This is example of an Uttarakhand uh, dashboard related to COVID-19. So this is run by Uttarakhand State Disaster Management Authority. Again, you can see the number of confirmed cases, recovered casualties, and the active cases. Further, we have also given with reference to the various districts that are there in this Uttarakhand state. What is the status of active, recovered, casualties, and confirmed cases? Further, on the bottom, you can also see that we can see where are the relief camps or the quarantine centers, where are the hotspot locations, where are the COVID care hospitals, and also where are the test centers that are available in the Uttarakhand region. Further, if we drill down, we can again see have a holistic snapshot picture of the number of samples that are being tested, again from various districts. So we can see that Dehradun, the total number of samples are more than 6,500, and then the number of negatives are very also high, and then some numbers are also awaited. And we can also see the information on the total samples, how many are positive and also how many negative and how many are awaited. Similarly, with the reference to district wise relief camps, again how many total with the various relief camps, or what are the people who are there. Further, in with reference to relief camp, how many people are there in various relief camp. For example, in Dehradun there are 121 people, whereas in Hardwar there are 233 people. Now this is as per the yesterday, so the things will change because this is a very dynamic phenomenon. Similarly, other states have also utilized. So I'm using an example of a Gujarat government, which again come up with this dashboard. The good thing is, based on the different dialects, language, the dashboard could be configured into different languages, multilingual. So in this case, it is in Gujarati and English, but could be in other regional languages. So dashboard will make people aware and maybe note them or read them in their own native languages. Again, you can see the various districts and the same number of cases and so on, and also which are the affected areas being represented through the map. Now let's also see that in case we want to get into how to develop these kinds of applications, what are the various softwares that are available. So from the map server perspective, we have some of the open source software as well as the commercial software. So from commercial, we have the ArcGIS server, GeoMedia web map from Hexagon, then Autodesk. We also have from SuperGeo, SuperGIS, and there are many more. Again, from the open source perspective, there is a geo server, then the map server, the degree open is a map guide. So again, there are various solutions so people can use it, either commercial or the open source. Now, if you see in the holistic coverage, if somebody wants to build this, what are the various 3-layer stack that we got? So we for developing these kind of system, we require a database system. We also require an application server. We also require a user interface. So from the database perspective, there are commercial players like Oracle Spatial, ArcGIS Server, Microsoft SQL Server, but we can also use Postgres along with Postgres or MySQL with spatial functionalities. From the application GIS server, as I said, we can use Geo Server or we can also use commercial ArcGIS, and open source we also have a map server and the mapnik. Now to serve them faster, we can also create tiles. So there are tile solution like Geo Web Cache and Tile Cache. Now from the user interface, so after the data is stored, we have a server which can crunch the number, display the images or in the form of OGC services to the user. We also need to work on the designing the user interfaces. So for designing the interfaces, apart from HTML, CSS and so on, we also required a GIS JavaScript based library for rendering the maps. So we can use either OpenLayers, Leaflet, GeoEXT, or we can also use thick client solution like QGIS, Google Earth, ArcGIS Desktop, or also the UTIC. Now I'm just covering few examples of internet map servers. So popular is a Geo server, which is Java based and confined to various OGC standards. So you can quickly publish. It has a good user interface wherein you can publish the raster vector data sets. It comes with a lot of plugins. So you can publish netcdf files, you can publish ADAS imaging files, you can publish shape files, and also the data coming from the Postgres and PostGIS could be easily published. in a standard OGC, WMS, WCS, and further it also support the OGC web processing service standard also. You can access this site through geoserver.org. As I said, from the database to the application server. Now for designing our interfaces, we also require a JavaScript library. So widely used are the open layers and the leaflet. So both allows you to include layers like vector, GeoJSON, KML, GML, also the tile layer as per the OGC standard, the raster layers. So you have two equally comparable options, open layers and leaflet. But leaflet is quite lightweight, is around 38 KB of JavaScript, provide all the functionalities. But uh, in case you are building also the 2D map and 3D map, so you can go with open layers because there is a tight integration with the Cesium JavaScript library, so you can serve purpose of both 2D and the 3D interfaces. Now, as I said, the dashboard examples that I have shown you earlier, most of those are using this ArcGIS dashboard application, which is available through ArcGIS Online, also to the ArcGIS server platform. But this is a proprietary, so it provides you a template wherein all the functionality, the data, the graphs could be easily generated with no coding requirement. The customization is also very easier. However, coming to the open source scenario, there are also customizable framework available which we can use for generating this web mapping applications. There's a one called GeoMoose, which again provide a JavaScript HTML based interfaces, uh, come pre-built interface. So you have all the UI functionalities of basic GIS tool of zoom, pan, measure, and so on. The layer controls, you can customize the look and feel, and you can add more layers. You can perform attribute as well as spatial queries. So this could be easily configurable using HTML and the JavaScript. Other tool is a map blender, which again gives you an out-of-box interface which could be customized, where the data could be fed. It comes with the widgets. Various widgets are available for layer controls, panning, identifying, and so on, and it can be customizable. Those who are working in map server, there's a customizable interface available called as a p.mapper, which is based on the PHP map script from map server. So again, the ready to use template is available. The data sets could be configurable, but all the components of a web-based GIS applications of GIS control, GIS tools, the mapping part, the legend part, the overview part can easily be customizable. Now coming to the completely no code or a low code scenario, there are still tools available. For example, those who are working on a QGIS, is a good plugin called as a QGIS to the web, wherein you can quickly publish your data. So once you install your QGIS to the web plugin, you can access this plugin under the web menu. So basically what this does, it does not require any coding. So the role is now to compose your map as per your liking. Once you have done with your symbology, color, size, you can use this plugin for publishing your map. Then again, it automatically you have an option of choosing whether you want to publish using JavaScript based leaflet library or a open layer library, and then automatically generates a web map. Here I've taken an example of a Jon Snow example, wherein the location of the pumps, the location of death I am representing only for a demonstration sake. So I've done the given different symbols, green color for pumps, cholera death in red color. So once I have added the base maps, OpenStreetMap and so on, I save my map and then I use that plugin to export this as a web map. Now you can see that it has created all those controls for me. The legend control, the the color deaths are represented in the form of a cluster. The tools you can see on the right hand side, the zoom control, the search controls. The good thing is it automatically generates the complete in files folder, where all your CSS goes into CSS folder, the JavaScript goes into JavaScript folder, markers, web front. Now what you can do is you can take this folder and you can put into your some web facing server, and then this could be accessed over the internet. Now again, from the QGIS perspective, there is also one more option called as the QGIS cloud. wherein they do have a, this is cloud-based GIS hosting option. They do give free hosting space, non-commercial usage. They have a plugin. Again, the concept is the same. And so in case you don't have your hosting facility, you can use this cloud-based solution. So again, to download that QGIS plugin, you can refer to this qgiscloud.com website. There is also good starter kit given there how to start. So again, you can compose your map in a QGIS interface, adding all the layers, the symbology and so on. Once you are done, you can register for the account, and then you can use that plugin, and then you can click on this publish map option, and the data will automatically get published into the QGIS cloud. So this is a kind of a no coding requirement kind of solution for publishing those GIS related web maps. So having talked about the first part of the role of internet GIS, where the concept of this mobile-based dashboards, mobile-based application for identifying the places, where are test centers, how to reach them, where are the quarantine centers, and also see the trend of the spread of the disease. Now let's go into the second part, which is how those mobile-based solutions are also useful in this combating this COVID-19. Now we know that GIS traditionally is confined onto a let's say a niche society who use it in certain scenarios, but uh, to increase the user base, the GIS can also be used on the mobile based devices, because there is a lot amount of cell phones and smartphones are available, wherein those kinds of applications could be deployed. So this mobile GIS concept comes somewhere in 1990, where there was a need for the field workers to carry out surveying and utility mapping. So this, because something can't be done sitting at the office, so people have to go outside and do the task. So again, it was primarily a wireless, but now it is can also be wired. Wireless is internet is widely available. And the good thing about this mobile GIS application is the datasets could be updated from the mobile web GIS based solutions. So you can get the rich content from the data, and also from the field the users can update those information. So this is the introduction about how does the mobile GIS is being used for the various professionals and organizations. Now from the this healthcare perspective, this mobile based solutions could help us in, for example, in the case of, we call as one of the category of mobile solution is the location based services, wherein the information based on your location could be relevant to your location could be served. This is just like in the case of a Arogya Setu app, where you can see the nearby people who are, whether there are any nearby people affected within 500 meter, 1 kilometer, 2 kilometer, and so on. And also as I said, there are some tasks that can't be completed from office. So instead of using a paper and pen based method, which is quite tedious, and also there's a chance of error coming to the picture, so this mobile GIS is being used, and this is quite useful because people want to have a map in hand. So in case you want to do some asset inventory of identifying the COVID quarantine centers, how many people are there, and so on, inspections. And now also for example, in Delhi, there's a door-to-door disease surveillance is also being said will be done. So these kind of mobile-based solutions are really helpful in carrying out this task in quick amount of time, less errors, and very fast results could be seen. So the definition of mobile GIS is an integrated hardware software framework which allows access to the geospatial data and services through mobile devices that could be either wired or could be wireless. Now, primarily mobile GIS can be viewed as an integration of various technologies. So we have a mobile device. We also have a positioning component that could be a GPS, which gives us the position, and also we require wireless communication coming from the remote internet-based application that is hosted in some remote location. The typical architecture of a mobile-based GIS looks something like this. So we on the mobile, so on the client side, we have a mobile GIS device. This could be smartphone or a PDA wherein the local data, or a mobile GIS-based software, or it could be in the form of a mobile-based app could be stored. And we also have a positioning system. So it could be internal, also could be external. Then we also have a server-side component wherein the data resides on the server. So before going to the field, the data could be sent to the client, and subsequently data that is collected from the field can also be synchronized and send it back across to the server. As I said, one more variation of this mobile-based GIS solution is called as a location-based services, which if you see is an integration of web GIS, mobile GIS, as well as the mobile internet. Since we have access to the on our smartphone the positioning the GPS devices, so we can find out. So, for example, in this case, it is just like every time we use our mobile eyes to find out the nearest ATM, the nearest restaurant, and so on. This so same technology could be used and is used in, let's say, the RG Setu to find out the nearest uh, whether there are some people who are affected in the within 1 kilometer and 2 kilometers and so on, and also to finding out the whereas the test centers, COVID test centers, and also how to reach to those places. Now, talking primarily on the what are the usefulness of these mobile-based GIS apps in pandemic. So, there are various use cases from contact tracing, which is being utilized from various countries. India is also using them to locate and to locating the nearby affected persons, and also identifying the COVID care facilities, along with the good helpline numbers, self-assessment test could be done. So, these kinds of contact tracing apps with all that information related to COVID bunched together is quite useful for preventing the person, his family, and then there's other people. Further, this mobile GIS base and other internet GIS could be used for door-to-door survey, where without using the paper-based system, the digital workflow mechanism could be done. The data could be captured from the mobile GIS apps or mobile GIS solutions and then be visualized on the dashboards. Let's take an example of the Arogya Setu app, which is a contact tracing app being of India. So it basically enables early identification and prevention. So it helps our family members from people from affected, and also once so it works on a Bluetooth based interaction. So every time we interact, and also we have a digital identifier for each device. There is no the privacy has been addressed in very safe manners. So all those interactions are being stored. So once we test somebody tests positive, and then automatically the status will of that person will change. Also, who has come into contact with those persons have also changed. So look, so this could be very helpful. So to break the chain, otherwise we will never know whether we have come to in contact with somebody who is infected, and we can again be a spreader of those disease. Further, where this Arogya Setu app related to this mobile base is very helpful is because once we register, we do a self assessment. So and we also have a GPS on and the Bluetooth on. So not only so these kind of self assessment also will help the people knowing where those person who are reporting they are unwell, and then subsequently use for identifying the potential hotspot, and then they can necessary interventions related to control and mitigate could be done. Further, geolocation-based COVID-19 statistics could be accessed. So anybody can access the people in their vicinity within 500 meter, 1 kilometer, 2 kilometer, 5 and 10 kilometers. And also along with the helpline numbers is also available. And also the list of ICMR testing laboratories is also available. For example, because our GPS is on, it is able to identify that I am from the Uttarakhand region, and then I can see all the lab testing labs. I can click on all, or I can select government labs or private labs, and I can also click on get direction. So we can also do it. Also tell me where it is if I don't know how far it is and how to reach it. The other important thing is in this a single app, the information about COVID, for example, in Uttarakhand, what is the status, and also it is updated as in when the cases are being reported, and also we can access the information at state level and also the India level. So all the information that we need is readily available in this single application. Now, various countries are using this contact tracing apps. So, from Australia, France, Hungary, Singapore. So, this will become very quite useful in using those applications. Similarly, from the ISRO Bhuvan perspective, Bhuvan has also come up with apps. I'm mentioning two here. One is a mobile Ritu Bazaar app, which is basically farmers farmer market related app, wherein for the small farmers we can directly and sell their product without the middleman. So now in COVID situation, the market is also affected, the transport is also affected, so these kinds of help in planning the transport and those kinds of aspect. Another is a home quarantine tracker. They have done a for the Narayanpet district in Telangana, where the geotagging is being done and the monitoring through the dashboard is being done. So this is what I was talking about, the web GIS along with the mobile GIS based application being used for combating the COVID crisis. Again, from the mobile GIS software perspective, there are various softwares from the proprietary to open source. So from proprietary, we have the ArcGIS, where we have the collector app, the navigator app, also the ArcPad kind of a devices for making informed decisions and collecting data. Similarly, from other proprietary like SuperGeo, we have a solution. Again, from Trimble, we have this TerraSync, those solutions. These are they are what you call desktop, there's software, Windows OS, mobile OS based applications, but they can also be, for example, in the case of SuperServe, it is a mobile app. Similarly, from Indian company perspective, we have a ScanPoint Geo, which have a solution called IGIS Mobile, which allows to capturing and performing those kinds of mobile GIS operations on the field, and then also submitting the data to the server. So you can access the link from the link given at the bottom. Now the third category of software could be are the cloud-based solutions where you pay for the subscription. Here I'm taking case of a GIS cloud application where the app along with the data is provided by the app along with the storage in the cloud is provided by the vendors. You don't need to spend anything. So we can define our questionnaire, build the form, and the real time submit the data, and then able to access the data over various interfaces they provide, either through a means of PDA devices or also on the desktop devices. Now from the open source perspective, we have various solutions. We have QField, which is a what you call as a field-based data collector app working on the principle interlinking with the QGIS desktop applications. We have also have an open data kit, and then we also have GVSIC mobile and GeoPaparazzi for creating those map-based questionnaires, forms. It also has information on how to store the data offline, that the data could be imported and exported. ODK is widely used. It provides an end-to-end solution from building the questionnaire form to doing the collection of the data by the using the Android-based devices, and also have a server-based solution wherein the data could be stored and visualized. Now, to taking the case of this ODK, subsequently I'm proceeding. So this is a news clip that I've got, wherein it was said that the Ministry of Health Affairs is launching district levels facility based surveillance. This I happens to got from the ODK website, wherein they are putting where those applications are being used. So it is also being used in India for mapping those surveillance related activities. Now, let me put this in perspective of how does this mobile-based solution are really helpful compared to, let's say, a paper-based maps which you are used to. So we can save the time, we can eliminate the need for a double repetition. So because once the data is collected on the field, then has to be again entered on the once the data is submitted to the at the system level. Because this disease spreading fast, we have to take a decision fast. So in the manual method, there is a slow process, the speed of transmission, and it will be a slower process because the data has been transmitted to a central control system which will first feed the data and so on. But in mobile based and near real time, once the data is submitted, anybody will be able to visualize once it goes through that validation process. Now we can also have increased accuracy of data. Now it will have a digital workflow with various business logic built in, which are mandatory field. What is the possible input criteria? So there is no chance of errors or omissions. And good thing is, since we have smartphone have all the various sensors, we can take pictures, locations, etc. using a single mobile based hardware. Now, taking an example of that household-based survey, so what we can do is as I said, ODK has three parts: the build, the collect and the aggregate. So we can create our questionnaire using the ODK build form, validate it through the ODK validator, submit it to the ODK aggregate server where the forms will be stored and also the data can be visualized. Then it ODK also comes with the ODK collect app, which is a Android based app. So which means there's a nothing, no coding, no configuration is much needed. So once you have installed the ODK collect app for the various people who are going to the field, we can connect to the ODK aggregate, which we can install locally or on the cloud, download that form and start submitting those forms. So on the right hand side you can see the various people who have submitted this the questionnaire going to the field, which could be a photograph, the location they have captured, and other attributes related to that the questionnaire they have collected. And then they can also see it into the graphical, into the web-based using backdrop as a Google map, and they can also download it and use it in the local in case they want to do some further analysis. Now, as I said, the building of the questionnaire is important task. So, in ODK build gives you a graphical user interface wherein you can drag and drop the various fields. So, on the bottom, you can see various fields. You want a text field where the user can fill the text. You want a number field where user can enter only number. You want a location field where the user can where the GPS will capture the location from the user, and also the whether the photo could be taken based on the camera that the user has got onto your mobile devices. Along with all the validation putting here, whether some is read only, whether it is a mandatory, then we can give drop down list options, whether instead of encouraging people to type because that could lead to errors, so we can have a drop down facility to reduce the number of errors and also to increase the to fast capture the data. So if we can just again put together various use cases of mobile based apps, as I said, the number of user base is increasing, so more number of people can do can be installed, these apps can be installed on the smartphone, so the information can be easily catered to the ground root label in the case of Arogya Setu and those kinds of apps where the information is readily available to the end user, because people, there are more, let's say, smartphone users who are accessing internet through smartphone than, let's say, web-based users. Again, there's no hindrance of mobility, and then so in the right in the confinement of your palm you have all the information that is available, so you no need to worry about wire or cable. Again, we can replace these kinds of apps are good for replacing the paper-based workflows, and good thing is we can also collect the data very fast and integrate across and submit onto the server side. The good thing about mobile GIS, since as I said, the smartphone already contains a GPS based info, we can identify the location where I am. So all those application could be built for navigation, emergency response, carrying out survey could be easily done. Further, it also provides access to the real-time information because it will be connected to the internet. So the moment the information is updated in the app, also the information could be visible in a near real time. So it will help in awareing the people of the situation, helping the decision maker, government, knowing where the disease, how the disease is affecting, what preventive measure has to be taken, and then to arrive at the whole solutions. So in the conclusion, we can say that this dashboard-based apps, this mapping of functionality of GIS, other facilities or tools of GIS, allocation, location, network analysis, dashboards are very helpful in combating and also sharing this information to the end people and also to the healthcare facilities. Then through the visualization, primarily through a dashboard, a single insight view of the data using graphs and various things, you can drill down all things within a single window interface. And also through the story maps, as I said, the spread of if you want to depict or show how the cases are spreading, who is moving from where to where, how the disease is spread, so interventions are possible. So we can say that GIS is playing a very important role in this COVID-19 pandemic. So with this I will close. So thank you very much for your attention.